Good evening. Welcome, everyone. I'm Dick Deming. I'm Medical Director of Mercy One Cancer Center and founder of Above and Beyond Cancer. Thanks for coming to the Cancer Education Series, which is brought to you with support from the Iowa Cancer Consortium. So welcome, and it's my pleasure to introduce my conversation guest tonight, Sadie Buchta. Sadie, welcome.
Thank you. So grateful to
It's
be here.
Well, it's great to have you here. Sadie and I got a chance to meet a week or so ago. Sadie is a massage therapist. She grew up in Glidden, Iowa, did her initial training in Ames, Iowa, and then spent time up at Mayo Clinic in Rochester learning massage therapy as it applies to helping with specific medical conditions. And we're at Mercy One Cancer Center beginning an integrative medicine program and are going to be bringing Sadie onto our floor into our new center to be doing massage therapy as part of our healing practice in integrative medicine. I was so impressed by Sadie and her approach to massage as it applies to medical conditions that I asked Sadie to be my guest tonight to talk about massage therapy as it applies to integrative medicine and to helping patients with various conditions. So Sadie, you grew up in Glidden, Iowa. How did you develop an interest in massage therapy?
Yeah, I have always had an interest in just overall natural wellness and healing. I grew up in a family that was about more of the natural, holistic side of medicine, and I wanted to explore that a little bit more. I also had personal experiences with family members who had gone through illness, including cancer, and just seeing how they benefited from massage therapy and inspired me to want to bring that to other people.
Yeah. Well, thanks for sharing that. I think it was your mom, right, that had
Yes.
gone through a journey with cancer. And were you in the midst of training, or had you already gone through training when your mom was going through her cancer journey?
Yeah. So actually, my mom was diagnosed after I had already become licensed. So I was very blessed to be able to bring that
Mm,
into her therapy.
yeah, I can only imagine what a comfort that was for her, but also for you. Maybe describe or reminisce a little bit about what that was like, and with your mom's medical condition and you being relatively new as a massage therapist, were you apprehensive? Was your mom apprehensive? How did that? I'm sure different days were different, but maybe think back the first day that you actually gave mom a massage after she was diagnosed with cancer.
Yeah. Wow. That's such a great question because I had massaged her before her initial diagnosis. And I had had my training at Mayo Clinic. So after she was diagnosed, she did trust me to work on her. And I think it made a profound impact on her life that she wasn't expecting, as far as just not feeling so alone in her body, if that makes sense, going through just the different treatments and what she was feeling, just getting that internal balance in her body through massage really helped her on her hardest days.
Yeah, I can imagine not only was she getting the therapeutic benefit of massage, but the just psychological benefit of being touched, but then also being have the opportunity to spend some quality time with their daughter.
Absolutely. Yes.
Yeah.
Absolutely.
So I would imagine that the memory of being able to give your mom massages during her cancer journey has sustained you in you know getting through the grief and in remembering her in a positive way.
Definitely. And I would say she is part of the reason why I really wanted to reach out and bring this to more people, just seeing how it benefited her so much. I truly believe it's my, for me, what I enjoy most in life is to be of service to other people. And seeing how this helped her really I want to bring that to everybody.
So let's talk a bit more about the medical training that you've had. So I've known many, many massage therapists, and but I don't know anybody who did part of their training at Mayo Clinic. So how did it happen that you learned that there was training at Mayo Clinic as a licensed massage therapist, and what was the process like for applying and interviewing and being accepted into the training program?
Yeah. So, in order to enroll in their program, they actually have you write an essay about your why. Why do you want to do this? And I was selected. There are 12 selected each time. So, 1 in 12 selected. And throughout my course there, we go through client specific, how you customize a massage for a person. We go through different kinds of medications, understanding, always putting the patient client first. So they walked us through everything we would need to know in order to feel comfortable working on someone who, maybe beforehand wasn't in their best interest.
And were they all inpatients that were in the
Yes.
hospital? Uh-huh.
Yes, they were all inpatient.
And what would be the process by which you would learn of their diagnosis, their medical condition, their limitations? Is that something that the nurse or the doctor, or would you just have access to the chart to read about the patient's condition?
Yeah, so it was a combination of all three. So we had to be responsible for effectively communicating with the whole team, the whole medical team, and then really critical thinking was involved in what would be best for this patient. And do no harm, of course. That's the number one thing, do no harm.
Mhm. Could you describe maybe a few of the interactions that you had with patients, various medical conditions that you were able to provide the benefit for with massage therapy?
Yeah, absolutely. So a few that really stuck out to me that would be for cancer. There was one, he was a younger adult who had a blood clot in his leg from chemotherapy treatments, and he was experiencing a lot of pain in that limb. Now, as a massage therapist, we're always trained never to work on someone who has had a blood clot in the last 6 months. But with my training that I had there and talking to the medical team there, we were able to provide massage for him in a safe way that benefited him to the point where he was finally able to sleep. He had not been sleeping, and he did not need to take any of his pain medication that he regularly was getting administered.
Gotcha. And so before you worked in a medical setting, it would have been nope, nope, can't touch you.
Yes.
But in a medical setting, knowing that the patient was being treated for the blood clot, but was still having lots of pain, you learned from the medical professionals that no, it's okay
Yeah.
to massage this limb, and in so doing, we're able to provide him great benefit.
Yes, exactly.
Any other examples you'd like to share with us?
Yeah, we had a couple too with breast cancer that had double mastectomy, and they were experiencing pain from limited range of motion due to cording that was happening, or axillary web syndrome, if maybe that's how you guys have heard of that before, if you've heard of that. And we were able to help work on their range of motion by doing myofascial release. And again, before I had had this training, that was just something that I felt was out of my reach. It's not something that I knew how to help someone with their range of motion due to cording. And also lymph node removal. Typically, we are told to avoid that area, but we were taught how to navigate around that and make that a safe therapy, safe experience for that patient.
So I would imagine that in your time at Mayo Clinic, especially these were inpatients, so they
Yes,
obviously were ill enough that they had to be in the hospital, that you became comfortable around patients with serious medical conditions.
absolutely. Yes.
Yeah. And and before that medical training, you probably were a lot more gun shy about getting anywhere near a part of the body where
Yeah.
there was cancer or where there was some serious medical problem going on.
Yeah, it was always we just wanted what's best for the patient, and if you're ever questioning it, it's best to do no harm again and not proceed.
So, the idea of having a massage therapist in the medical center, or as we're going to be talking about, in the outpatient cancer clinic, really excites me because there's the opportunity for collaboration. You know, we call massage therapy one of the integrative medicine practices, and the term integrative is, you know, it's not either or. It's not like you go through cancer treatment with chemotherapy, radiation, and surgery, or you seek something else. It's integrated, and not only is the therapy integrated, but you know the fact that you and I will be together on the same floor, seeing patients together and collaborating, really excites me as to how I can help impart medical knowledge to you, and you can use that to help influence the way that you can help the patients.
Yes, 100% agree.
Um, what is the typical duration of a massage that you might do in a medical setting?
That's a great question. So that's going to be a super subjective scenario type thing that we would have to consider. Typically, in an inpatient setting, it's no more than 30 minutes. But for outpatient, I would expect 60 minutes to be perfectly fine.
Okay. So some of the conditions that I see that are either a result of cancer or a result of cancer treatment. And let's just talk about some of those and maybe describe how you would approach them in terms of the massage therapy as a modality to help improve quality of life. You've touched on one. You talked about
Mhm.
the axillary webbing,
Yes.
and we would also maybe add into that arm edema or pectoralis or latissimus stiffness that can happen after radiation therapy. So
Yeah.
let's say this is a 52-year-old woman who is now 1 year out from chemotherapy, surgery, radiation therapy, and is cancer free, but has persistent right arm edema, some limitation of the range of motion of the right arm, and some painful fibrosis or thickening or stiffness of the pectoralis muscle, the chest wall muscle, and the latissimus dorsi muscle. How would you approach massage therapy in that situation?
Great question. So, I would first want to address the fibrosis or that scarring that they are experiencing to see like what is the root of their range of motion being limited. Is it from that scarring or is it something else going on? If we found together that it was rooted at that scarring, we do something that's called cross fiber friction. It is part of a Swedish modality. If you've heard of Swedish massage, it's really just a blanket term for a bunch of different techniques that go under Swedish. And cross fiber friction is one of the most effective, along with myofascial release, for relieving any of that scarring that would be under the tissue. We work that layer by layer. So it's not aggressive by any means. We would have to do probably, multiple sessions in order to see results. That's something I never want people to have false hopes for what we can do in a session, but any massage is going to improve that internal environment no matter what. So that would be the first thing, work on that scarring. Then for the edema, that is where we would use what's called manual lymphatic drainage, MLD. And I have had the training to do that. And that is a very light, non-invasive technique that requires a lot of critical thinking, because it's kind of like we have to take the lymph that is not moving as freely as it normally would and bring it elsewhere so that it can move more naturally. And that's probably a topic for another time, because we could go so in depth with that lymphatic system. But I do have the training to go through what that would look like. But basically, we would just move it to another area where it is functioning more freely, and hope that that brings that swelling down immediately.
And if someone has some tenderness associated with the fibrosis or the scarring, how do you get into working that in the setting of some tenderness or discomfort?
Yeah. So with tenderness, I always ask, on a scale of 1 to 10, can you tell me what your pain level is at? And if it's ever above a 7, I'm going to back off on pressure. We hear the common, we have all heard, the harder you go, the more results you're going to get for massage, probably at some point in our lives. And that's not true at all. I say that hard pressure is like yelling at the body, and soft pressure is like whispering. Right. So we want to make it a more relaxing, enjoyable experience. It should never be painful.
Gotcha. So one of my favorite philosophers, Friedrich Nietzsche, said, "Was dich nicht umbringt, macht dich stark," which means that which does not kill you makes you stronger. But I would say that he probably wasn't referring to massage therapy.
No, not at
Yeah,
all.
no pain, no gain is not really the best
That is
approach.
not the mindset you want for
Okay.
massage.
Well, let me tell you about a patient I saw today. So, a 60-year-old gentleman who had cancer of the throat and went through chemotherapy and radiation therapy. And now, as a consequence, has peripheral neuropathy of the hands and feet, difficulty fully opening his mouth, so decreased range of motion of the temporal mandibular joint, the jaw,
Yeah.
um, and some fibrosis of the neck on the side that had the most radiation, and some submental edema. How would
Sure.
you approach devising a plan for therapeutic massage for that type of a patient?
So for him, I would want to look again at that joint, that temporomandibular joint here, see what's going on, try to reduce any of that fibrosis or scarring that he may have there. And again, with any type of lymph, we want to remove that extra edema from the area. So what that would look like, that's something you can actually do on yourself, is kind of taking in the morning, if you're trying to take your wrinkles away from your face, it's a very slight pull back, right? So if we went here, and with our fingers, you kind of cup this way and make a half rainbow down, because all of the lymph that we experience above our clavicle needs to come down. The main lymph, the cervical lymph nodes where that edema needs to drain to, needs to come down. So I would bring it down from that area, and then again down into the next main group of lymph nodes at the axillary region.
Okay. And how about a lot of patients who've had chemotherapy have persistent peripheral neuropathy, numbness and tingling of the hands
Yes.
and feet? Is that something that you've worked with?
Yes, my mom actually is still struggling with that, and massage therapy has helped her. Now, it's not something that I can take away by any means, but it has reduced some of that kind of pins and needles feeling that she can get sometimes. But I can't say that I could for sure help that in one session.
Okay. And then let's say a patient is like just general aches and pains and feeling kind of down and blue just because their world has changed and they can't seem to get the energy to get back, and they've had to maybe cut back at work or even will have lost their job and are just kind of fatigue and loss of energy and a bit depressed. But they don't have a specific physical limitation or ailment. How would you approach a patient like that?
Overall, looking to treat them relaxation. No matter who comes in, whether they have a specific condition they want me to work on or they're looking for just relieving some of that stress and depression that's associated with their treatment, massage therapy is going to benefit them regardless.
So you are now in a situation where you're teaching massage to
Mhm.
students, and you also have a private practice. Uh, is that correct?
I don't have one anymore. Actually, I
Okay.
stopped practicing in 2020 because I was working more closely with my mom at that time. So that's where I poured everything into my teaching more and thought if I can't do teach. So I teach most of the time. And that's why I'm super excited to get back into working with individual patients.
Yeah, so I've been a doctor since 1980, and I've had, the opportunity to take on teaching responsibilities and administrative responsibilities, but fortunately, I still get the opportunity to see patients one-on-one and be a doctor. And I'm just thinking the difference between doing and teaching. There's rewards from both. Maybe ask you to reflect a bit on that. What does it mean to actually be able to one-on-one provide therapy to a patient?
Wow. Yeah. Again, it just feels like my purpose is to be of service to other people. And without that, for me, there's a void. I
Mhm.
truly just believe that my sole purpose is to help other people. And as someone who's walked alongside family and friends that have gone through some hard illnesses like cancer, I just feel it's a part of my life that I want to fill and help other people.
Um, we're always learning, lifelong learning. For me, it's attending conferences, it's reading journals. What's the process by which you learn new techniques, grow as a therapist, and how do you see the field of massage therapy changing from when you first got into it to where it is now, to where do you think it's going?
Oh man, it is going so much farther than when I first started. Going back to the education, I am a bookworm. You can catch me reading every night about new things about massage therapy, especially with teaching. I really like to stay on top of everything. And I have really high expectations of all the students that come into PCI. So I better be up to those expectations myself, right? So I constantly am taking classes, just getting all the information that I can, a sponge, if you will, for information. And I think that massage is going to grow so much in the next couple of years because it's not seen anymore as just a luxury thing to do. It's being seen as a health and wellness side of
Mhm.
everyone's just overall daily lives. And I think that's the main thing. We're going to start seeing it in new locations and it's going to get a new respect for what it has to offer.
So, as a massage therapist, obviously it's a very physical intervention. At the end of the day, where do you feel it the most? Is it your hands, your arms? Is it your legs from standing? I mean, what where do you feel the physical stress of actually doing massage, and what do you do for yourself for self care?
Yeah. So, as long as the body mechanics are in line and how they should be, the body really shouldn't be sore at all. I would say most massage therapists would probably agree that it takes a lot on our mental and emotional. So we have to be very good at being able to separate just taking on everyone's emotions and instead walking with them. And that's one thing for me is I have to come back and just reflect and just clear out, have that mental clarity for myself. So it's not so much the physical, it's the emotional, mental side of being of service to other people and learning not to take on what they have, but walk with them.
Mm-hmm. Yeah, that's beautifully put. I think you're right. Whether you're a doctor, a nurse, or in any caring profession where empathy is of great value, you have to, um, as you said, walk with and not take on all of the burdens of the people you're trying to help.
Yeah.
Yeah. Let's open up some questions here. We've got a live studio audience. So we've got a microphone, and George, if you wouldn't mind helping with the microphone. Questions from our studio
I've got
audience.
one actually.
Oh, George has a question.
Yeah.
Okay.
The difference between acupressure, chiropractic, and massage therapy. What are the difference in the pursuits?
Oh, love that question. So massage therapy, acupressure, and was it chiropractic?
Yes.
Okay, so from what I know about that is acupressure is a modality form of massage therapy that we can add on to our license, but it takes an additional, I believe, 150 hours in order to say that you provide acupressure. Now, acupuncture is different. That's where they would actually use the needles, and that is pretty, I want to say about 4 years of education. And for chiropractic, I also want to say that's around more like 4 years, but I'm not 100% sure. The main difference that I know of is I needed to have more of hours-based education, whereas chiropractic, you would have to have more from a bachelor's level, I believe. Hopefully that answers your question.
And how about the technique itself?
Technique. Okay, sure. So for acupressure is based off of meridian lines that we have in our body. So it's very Eastern theory based. And it's believed that along those meridian lines, there are certain points that we can press, and it influences certain internal organs and just functions of those organs. Again, I'm not trained in that, but that's what I know of it. And then chiropractic is more manipulations of the structure of the body. So all of the bones and joints of that sort. And then massage, we focus more on soft tissue. So muscle and fascia, which people may be wondering, what is fascia? And fascia is almost like packing tape that encapsulates every single muscle in our body. It's around all of our organs. And we, as massage therapists, can work with that superficial, meaning top layer of fascia.
Okay, great. Thank you. Another question?
Yes. You mentioned you are teaching. So if someone wants to, after they've seen you at the cancer center, to come and get a massage from you, is that possible?
It would not be from me. It would be from students that learned from me or other fellow educators there. But you would absolutely be welcome to come in and receive massage.
And I miss, where's your office?
It is at PCI Academy in Ames. It's off of South Duff.
Okay. Got another question here.
Hi, I have a real specific one. I have 4 lymph nodes that have been removed on my underneath my right arm, and I was wondering, how would you go about massaging a person like me with that?
Yeah, great question. So anytime lymph nodes are removed, I am going to first start at the very top of the limb. So we'll say talking here, and I avoid going towards those lymph nodes. So I work the very top. And if you have swelling at the end or distal area, we would start the top here, bring all of that fluid to the top, and then we carry it actually either to the cervical lymph nodes, or we would bring it across this way to the other side where you have all of the lymph nodes. The thing with lymph is when we have nodes taken out, your four lane highway turns into a 2-lane. So we really just try to redirect that lymph. Hopefully that answered your question.
That does answer. Thank you.
So I have a question for you.
Yeah.
I recently probably tore my hamstring, and so I've been getting some guidance from all of my workout buddies, and so I haven't actually had a massage, but I now have some power tools. So my question is about power tools. So most people that work out are familiar with foam rollers, and you just roll. Well, now there are motor foam rollers that vibrate at various speeds. And I also was loaned it looks like a hand drill, but you put different adapters on it and it goes boom. So my question is, is there benefit? Is there any role for power tools, whether it's vibrating rollers or various types of thumpers in providing therapeutic benefit for various aches and pains and strains and sports injuries?
Insert injury here. Yes, absolutely there is. I love this question. So I actually have one myself. Maybe you've heard of the common brand Theragun. That's a super common one.
I have heard of Theragun, yes.
Yeah, so what vibration does for us is it actually causes an anesthetizing effect. So when we use that vibration, it actually is going to confuse our central nervous system. And instead of receiving pain signals, it completely numbs it. So we actually use those tools when we're doing like trigger point therapy in order to get deeper into a trigger point, because that way we're not causing any harm. Whenever pain is involved, our body is not going to relax any farther. So we always want to avoid pain with massage. If we don't, then your muscles tense up and they're like, what are you doing? So that's when we would use like that Theragun. It's a great tool for that.
Okay, interesting. Okay, we have another question.
I forgot to say earlier, I'm so excited that you're going to get a cancer center, because prior to the pandemic, Mercy One did have a massage therapist, and I would see her once a month, but haven't seen her for 2 years. So I'm excited that you will be there. Also, I have lymphedema and I have spasmic dysphonia in my voice. So have you ever worked with someone with spasmic dysphonia?
So it's the term is spasmic dysphonia. So you can probably hear it in Poon's voice. Is that a medical condition that you've ever worked with?
It is not something that I have ever worked with, but it is something that I would love to work with and I will look more into. Lymphedema, I have definitely worked with. So that's something I would love to help you with.
Other questions from our audience?
Here's a quick one, Doc. If you can comment on the assessing and analyzing the different levels of sensitivity that patients have to massage therapy. The same massage to the same person with you think is the same condition will be extremely painful. The other person, not so much.
Yeah, or you get somebody who just giggles because they're ticklish. So how do you gauge what level and type of touch for someone who's either number 1 squeamish, number 2 ticklish, or number 3 senses everything as painful?
Yeah, so it's always a very gentle approach when we're trying to decide, what's the best pressure for you. And it's hard to explain because it's just it comes very natural once you feel it. You can sense the tissues tighten, and we just know when to back off. Anytime that tissue starts to hesitate our pressure, that's when we know, okay, something is uncomfortable, discomfort. So it's really communication between therapist and patient for what that looks like for pressure.
Okay.
I have another question. How do you massage someone who's got like a port?
Yeah, great question. So I learned a lot about this at Mayo and also with my mom. And sometimes that port can cause discomfort getting worked around. So I approach it with a very light MLD, manual lymphatic drainage approach. So it's very possible. And we always make sure that you're positioned in a way where that's comfortable for you too.
So it is possible to get a massage even though you have a port?
Absolutely.
Okay.
Yes.
Mhm. And probably the same thing applies to somebody who has a pacemaker.
Yes.
Hockey puck under their skin up on the chest.
Yes. Yes.
Feels like.
We have a hockey player here tonight, but the pacemakers are getting smaller. They're not the size of hockey pucks anymore. I assume hockey pucks have not gotten smaller in the last 20 years. No, they haven't. Okay. Sadie, anything else you'd like to share? What are some, let's say, myths about massage therapy? So if you were to be a myth buster and set the record straight about massage therapy, what are some people's misconceptions? And what would be some, as someone who's going in for a massage therapy session for the first time in their life, what should they be aware of?
Yeah, so I think common misconceptions, one we definitely covered is that no pain, no gain type of mentality is not beneficial for massage therapy. But also just seeing massage therapy as not a luxury thing to do, but as a way to maintain your wellness and have that internal balance just where it needs to be, right? So for me, that would be the main thing about massage therapy. And for myself, I am just super grateful for this opportunity to be working with you guys and provide massage in a way where I hope you are comfortable opening up with me about your needs and wants and expectations from massage.
Great. Well, again, we look forward to having you on the staff at Mercy Cancer Center, being part of our integrative medicine program and providing massage for our patients. Thanks, everybody, for coming this evening. If you know someone that you think would learn from tonight's education session, this has been recorded, and this video podcast will be available for on-demand viewing at the Above and Beyond Cancer YouTube channel. It'll also be available for on-demand viewing at the Mercy Cancer Center website. So thanks again, Sadie, for joining us, and please join us again next week. Thanks, everybody.